Of arthritis in a knee. You can see on the left we have a pristine, beautiful white knee, and in this knee you'd see nice, smooth, articular cartilage. In a little bit I'm going to show you a picture actually inside a knee without arthritis and with arthritis, so you can see for yourself the difference. But you can see over here, the next middle picture, we have a knee that has some red dots there on the inside of it. This is the early beginning signs of arthritis where the cartilage begins to break down and degenerate. It's kind of, I tell my patients, it's kind of like if you were driving your car around a curve every day, eventually you wear down the inside of your knee, and this is kind of what happens in a knee where you have an injury, the weight is not borne directly down through it, and eventually the side of the joint begins to break down. And then of course on the right side we have a knee that has what radiologists would call tri-compartmental osteoarthritis. And in that type of knee, what you have is all three compartments of the knee involved. So if you look up here, you have the medial or inside of the knee, the lateral side of the knee, and under the kneecap. And this is the type of patient that will often have significant knee pain and eventually need a joint replacement. So, what do we see when we x-ray a patient? When you come into the office, you usually get an x-ray from your orthopedist. And so this is an example of a knee on the left that is pristine. There are many people, I'm sure, that would be envious of this x-ray. And so, what's normal about this? Well, you can see here and here that there's space between the bones, and over here, right here and here. And that space on the x-ray represents cartilage or tread on the tire, if you want to think of it that way. And through one of the factors, or maybe a combination of the factors that we discussed earlier, this patient's gone on to wear away the cartilage and develop arthritis in the knee, and that's evidenced by almost the complete absence of joint space on the inside of this knee compared to the nice thick joint space there, and you can tell just by looking at the x-ray, this patient probably is not feeling very good.